One of the things we feel in this committee is that we develop the science that would make the lives of women better worldwide. Women's health has always taken a back seat to men's health. That has been a long-standing issue. That's what we're trying to do with thrombosis and hemostasis, because worldwide, it's astounding to know the number of women around the world who die in labor and delivery from postpartum hemorrhage because they've never been diagnosed with a bleeding disorder or because they acquire a bleeding disorder. And there are none of the diagnostics and therapeutics that are available to be able to both early diagnose and also treat.
The women's health became a much more prominent global policy issue and work for a better quality of life for the women. We have experts at ISTH studying, investigating the thrombosis issue in women, and also to understand what is the cause of the bleeding in women post-delivery or the reproductive age.
The centerpiece of our focus on women's health and thrombosis and hemostasis has been the Women's Health Hub. And we know the amount of misinformation that's out there. We have a member of our committee, Teresa Nagawa from Nigeria, although she couldn't be here, sent us some comments. They have to convince the governments in Africa, where women are dying unnecessarily, that this is a political and an economic issue, that it makes economic sense for women not to die in labor and delivery. How do you make that argument? You make it through data. And that's how you might be able, in a country like Nigeria, shift the policy from not having the proper diagnostics out in the field to having them and also having access to the therapeutics they need, because it is economically and politically important to save women of childbearing age. Those are the ways we hope data will translate into action in rightful policy.
We, with scientists, could make better investigation and bring better studies and the results. However, after this multidisciplinary study, we need really to collaborate with the other organizations, with patients' organizations, with several types of committees to make our voice stronger. Every woman should feel that we are there and we are taking care of their problem. Their voice should be heard. And we want to make sure they are taking care also of three messages: recognition, empowerment, and solution and advocacy. And for reducing the mortality, this type of work is necessary at this point of time. This kind of problem could not be solved with a single organization. So what we need to do is actually getting together with all other type of organizations and making solution of such a problem, which in women health is the priority, has been taught and recognized at the end of the story. It's very important for them to understand their voice is heard by us.